Welcome to the FEM Health Podcast, where we talk about women's health from a modern perspective and go behind the scenes to talk about issues that most women don't know about. Today, I have Dr. Stacy Henigsman with me, a one-of-a-kind OBGYN with a one-of-a-kind mission. So, Dr. Henigsman, would you care to introduce yourself?
Yes, it's so great to be here. So, I am Stacy Henigsman, an OBGYN, and I'm actually the founder of FEM Survivorship.
That's amazing. So what do you mean, I guess when it comes to FEM survivorship, what, tell me more about just what that title means to you.
Yeah, absolutely. So, it's a survivorships program specifically for women with breast and gynecologic cancer.
Oh,
So, we
okay.
treat women from time of diagnosis throughout the whole rest of their survivorship journey. And so, we treat them from the beginning all the way through the rest of their life.
That's amazing. I think I heard that you were just at the Bracket Strong 10-year anniversary
I
gala.
was, yeah,
That's
I was
amazing.
so honored to be there. It was great. It's a great mission. Tracy is the CEO,
Mm-hmm.
and she does so much for women with advocacy and education, and she does care packages for women.
Oh,
And it
wow.
was really kind of the start of FEM survivorship. So I was
That's
honored. Yeah, I
amazing.
was
That's
honored to be there.
amazing. Oh my God. And you gave a talk, right?
I did,
Amazing.
yes.
Can you give us a summary of your talk?
Yeah, absolutely. So I talked about really why I started the program and what the program offers.
Mm-hmm.
And I really wanted to get the word out that survivorship really is standard of care for
Mm-hmm.
all women with breast and gynecologic cancer. And so many women, actually up to 60% of women with breast and gynecologic cancer, do not have access to survivorship programs. And so I'm really here to educate the public and
Okay.
also to provide service to women that don't have survivorship care.
Wow. And I guess what, I mean, that's an amazing mission, and I bet it takes a village to even bring that
It does.
out. So I guess my question to you is, what inspired you to start something so, I mean, an OBGYN is, I mean, not completely different,
Yeah.
but I feel like when I hear of an OBGYN, I think more like they work either with cancer patients or they just see routine patients. So I guess what inspired you to just completely deviate?
I know, that's it's true. It's such a good question. I was talking with my colleague the other day, and he
Mhm.
said, "How on earth did you come up with this idea?"
Right. I
'Cause
agree.
yeah. He was like, "I have no idea. You have to tell me the story." So,
Mhm.
I mean, really to answer that, you have to go back to the very beginning
Mhm.
of my journey in residency,
Oh, wow.
and I trained at the University of California, Irvine,
Okay.
which I trained under Philip Desaya, Michael Berman, Bradley Monk, and really they are like the godfather of gynecologic oncology.
Okay.
So in residency, we did so much gynecologic oncology, and I got to work firsthand with women that were, fighting ovarian cancer, uterine cancer,
Wow.
cervical cancer,
Mhm.
and I really could relate to them, and I felt a really strong connection to these women. And then when I was in private practice, I took care of numerous women with breast cancer, endometrial cancer, ovarian cancer, and their struggles really touched me because they had so many issues with sexual health and intimacy concerns and
Yeah.
body image. And I just felt a real connection with these women.
Mhm.
And then the real reason, if you want to get down to why I started this program,
Mhm.
is that my sister was diagnosed with breast cancer when I was in residency.
Oh, wow.
And I saw her fight for 20 years, and she didn't have access to a survivorship program.
Mhm.
And so I really was the one to help her through everything,
Okay.
her treatment decisions, her side effects, and just talking to her when things were hard.
Mhm.
And I thought to myself, she's not in a survivorship program. Like, this is crazy to me. And then actually last year she died of
Wow.
breast
Okay.
cancer.
I'm so sorry to
And
hear that.
thank you. Thank you. And when that happened, I just thought back and I thought, if my sister didn't have access to this and all these other women don't, then I need to create this program.
Absolutely.
So that is why I created FEM Survivorship, to help the countless women out there that don't
Mhm.
have access to this program.
Wow. And do you think, I mean, why do you think that is? Like, do you think that they think that, oh, they're treated, they're good to go, or is it more just a lack of awareness, a lack of because I feel like your battle doesn't really end once you you just went through probably something super well, not probably, you just went
Yeah.
through something very emotionally, mentally, and physically taxing,
Yeah.
even if it's a stage one or
Yes.
something that can't be treated per se. So I feel like, what do you think is the reason behind that?
I've thought a lot about this,
Mm-hmm.
and I think there's a couple of reasons. I think in the US, we've gotten pretty good at treating cancer. I
Okay.
think we have, surgeons, we have oncologists, we have all of this to treat the cancer. And so, and which you have to do, right? I mean,
Right,
you have to
right.
treat, hello, you have to treat the cancer.
Yeah, that
So,
part's the easiest. Not easy, but that's the
right,
standard, I guess, of care.
right,
Yeah.
exactly. So everybody's focused on treating the cancer, treating the cancer.
Mm-hmm.
We do that pretty well. But then who treats the woman?
Right.
So you have someone treating the cancer, but then you're left with the woman who nobody is really treating.
Right.
And I think the other issue is we don't look at survivors as a distinct population. So we
Mm-hmm.
look at patients that have diabetes, distinct population, high blood pressure, a distinct population.
Right.
We don't look at survivors as a distinct population that have their own set of issues.
Yeah.
And so there's really no, guidelines
Right.
to
Yeah, it's more like
treat.
cancer patients, and then you just go on. You're
Exactly.
done. Like,
Exactly.
yeah.
And
Okay.
so, and I think survivors, well, I don't think I know, survivors are getting ping ponged around. So
Right.
they'll go to their oncologist and ask a question, and the oncologist says, "Oh, you have to talk to your OBGYN." They talk to their
Mm,
OBGYN and they say, "Go to the oncologist." And so,
right.
and these poor women are stuck in the middle and they're tired. They've been through a lot,
Yeah.
and they sadly they kind of just give up. And
Yeah.
they're like, "You know what? I'm tired. I can't do this. I'm trying to live my life." And so it's just everybody just kind of gives up on them.
That's true. I mean, you also, like you said, you don't want to be thrown around to multiple practices. I think
Yep,
it's better if you're going through something like that. You need the support. You need centralized support, and you need it to
exactly.
come from one place, and you need
Yep.
to know where to go when you're feeling or need certain help. And I think that that's very true. I mean, my mother is a breast cancer survivor as well, and I honestly don't recall any type of survivorship care
Yes.
even like mentioned to her. I mean, I know she followed up like once a year with her breast physician, but that was like the first 5 years, and then I think that was it.
Yeah, exactly.
And now hearing this, I'm like, wow. I mean, even just the name alone, I can kind of already understand where the program is trying to go with its patients.
Right.
So I guess my question to you is, if I'm walking in or somebody walks in as
Uh-huh.
your new patient,
Yep.
what are like the main services you offer, and like what does that look like for them if they join FEM Survivorship?
Yes. So we follow NCCN guidelines,
Okay.
which they do have guidelines, kind of rudimentary guidelines
Mhm.
for what a survivorship program should look like.
Okay.
So they come into the program and they're going to meet me in
Mhm.
the beginning, and we're going to go over their entire history. So their surgery, their treatment, and
Mhm.
then their symptoms. So what are they experiencing? Are they
Right.
having problems with hot flashes? Are they having, sexual concerns? Do they want to lose weight? Do they need help with nutrition?
Mhm.
Physical therapy. So we're going to address all of that. And this is all going to be under one roof, and it's all virtual.
That's
So
amazing. I
it's,
think that helps so much.
it does. And so we can reach women in rural areas, women that are too
Mm.
busy, working outside the home, and women, like I said, that are just tired and exhausted.
Right. Yeah, I mean, you
And
just went through probably an excruciating surgery, and I know the recovery isn't easy for
exactly,
either, so.
exactly. But you can actually get on the computer
Right.
and do a visit. And so
Exactly.
it's so much easier. And so everything's done virtual.
Mhm.
All of our partners are all virtual. So
Oh,
mental
okay.
health is virtual, physical therapy is virtual. I have neuropsychology for brain fog, which is
Oh,
also virtual. So
okay.
everything is under one roof.
Mhm.
I'm obviously an OBGYN, so I'm going to treat the menopause symptoms,
Okay.
vaginal dryness, hot flashes, all of those
Mhm.
things. And so this is all a comprehensive program done via telemedicine.
So when it comes to, you just said menopause.
Mhm.
So explain that a little bit more, because not that I got a little lost, but I guess, what do you mean? Is it because of like hysterectomies, or how does that come to be? And is that really something so common when I'm assuming when you're a younger woman that maybe wasn't planning on going through menopause so early?
Exactly.
Like
Yep.
how does that look for somebody like that?
Exactly. So a lot of our breast cancer patients, our
Mhm.
endometrial cancer patients, these are estrogen sensitive cancers. And
Okay.
so how they're going to be treated is for breast cancer, for example, typically you're going to have to do a mastectomy. You
Mhm.
may need chemotherapy, you may need radiation,
Mhm.
but then the oncologists are want to if you are estrogen sensitive positive, the cancer is estrogen positive,
Mhm.
then the oncologist is want to turn off that estrogen. So they're going to be placed on medications.
Okay.
So tamoxifen, aromatase inhibitors that are going to cut off estrogen completely.
Wow.
So that's going to send them into menopause. And typically it's an early menopause.
Right.
The same way with ovarian cancer, cervical cancer, endometrial cancer. Typically, you're going to have a hysterectomy and you're going to get your ovaries removed. So
Wow.
then that's going to send them into typically
Of
an
course.
early menopause or menopause period. So they're going
Wow.
to have all of the issues with hot flashes, vaginal dryness, decreased libido,
Oh,
bone issues.
wow.
So,
And I imagine as a woman, I mean, for lack of a better term, I feel like, these are like the parts of our body that are the most, feminine. And
right.
I feel like maybe going through something like that, especially at such a young age, maybe it's like stripped from you, I guess, your femininity, maybe it feels stripped. So I can understand why it's hard for people to come back to themselves or feel comfortable in their
Mhm.
new body, I
Yeah.
guess. So
Yeah. Absolutely.
yeah,
Absolutely. They have a lot of issues with their partners a lot
right.
of times. And so that's why we offer counseling with families and
Mm-hmm.
partner counseling because yeah, they're going through all of this both physically, emotionally, and then you have menopause on
Right,
top of all of it.
right.
So, and I mean, menopause is so talked about and controversial for lack of a better word.
Mm-hmm.
And just think about if you're trying to treat a cancer patient who's in menopause.
Right, right,
So
right, right.
it's complicated, it's tricky, but it has to be addressed.
Yeah, absolutely. And I feel like people talk about menopause, when you're in your, I guess, I don't know how early menopause may be for some people, but usually like late 40s to early
Right.
60s is when it
Yeah.
usually starts. So I can imagine even sooner. I mean, I feel like that's so not talked about, like cancer induced
Yes.
menopause, let's say,
Yes.
right? So I think that that's a big deal to treat that and to even offer that as a service because
Absolutely. I
I
think
think, yeah.
well, sorry.
No, no, it's okay. I was gonna say, I think it's a conversation that isn't had enough, and it should
I
be,
agree.
especially if you're a cancer patient.
I agree. I
Yeah.
think it's something that used to be taboo. I think it's becoming more mainstream now, which is
Mm-hmm.
amazing, but it's not becoming more mainstream in the cancer community. And
Mm,
that's what we really have to fight
right.
for these patients.
Absolutely. And even, I mean, like you said, even the sexual health and things like that, I feel like just because you underwent something so excruciating and something that is very taxing on your body, you shouldn't feel like you can't still enjoy your partner the way you were, enjoy your life the way you were. I feel like
Yep.
it's just a new chapter and there's a way to bring that out. So that's amazing that the program can help with that.
Absolutely,
Yeah.
absolutely. And I mean, I'm a real big advocate on sexual health, menopause health, because I think if you have that part of your life in order, for lack of a better
Right.
word, then, everything else kind of feels more normal,
Right. And
you know?
I think when it comes to like typical, let's say post cancer survivorship care,
Mhm.
you have the mental health. Okay, great. That's self-explanatory. I'm not sure about the hormones and the sexual health though specifically. I feel like I don't know.
It gets really tricky, right?
Yeah.
Because you have breast cancer that's estrogen receptor positive, progesterone receptor positive. You have endometrial cancer, which can also be estrogen receptor positive. So then you have to look at other ways to treat those menopausal symptoms.
Mhm.
And I'm really happy that guidelines recently came out through ACOG and our oncology guidelines that say that you can actually use vaginal estrogen
Mhm.
in these women with estrogen sensitive cancers.
Okay.
And that in and of itself is amazing that we can do that because when I trained in 2002, it was kind of like you can't use vaginal estrogen.
Really?
And these women suffered so much. They couldn't have intercourse. They were having, recurrent UTIs. I
Oh
mean,
my gosh.
horrible, horrible things.
Oh,
So we've come
a long
better. We're
way.
a little bit,
Right.
a little bit. So now we're using vaginal estrogen for
Mhm.
these women, which is great. But
Mhm.
then you have to do other things for their hot flashes.
Right.
So, you have to kind of work around what you can and can't use.
Yeah.
So it does get more complicated, but there's things that you can do for these women.
Right. 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 That's amazing. I mean, I feel like you can change a lot of lives with the type of comprehensive, well-rounded program that you're offering because it's not just, hormones and
Right.
sexual health now too. It's also mental health.
Yes.
I think when I was reading about your program, it said sleep therapy.
We do. Yep, we
Yeah,
do.
that sounds fun.
So, yes, sleep is you have to get good sleep in
Mhm.
order to feel your best. And we actually partnered with a online telemedicine program
Mhm.
called Sleep Health,
Mhm.
and they do sleep studies from
Okay.
home,
Oh.
and they send you the sleep study. You complete that at home. It takes a couple of days. You send that back, and
Mhm.
then they'll have a board certified sleep therapist review everything, see you online. If you need a CPAP machine, they'll send it to your house.
Oh
If you need
wow.
anything else, they'll send it to your house so you don't have to actually go to a sleep study center,
Mhm.
which, a lot of cancer patients don't want to go get out of their house and go spend 2 nights doing a sleep
Yeah.
study. And so
Yeah.
this you can do in the comfort of your own home.
Mhm.
And I've sent numerous patients to them and they love it.
Oh.
And they've gotten their CPAP machines, they've gotten diagnosed. So it's really, really convenient
Mhm.
and amazing.
Right.
So
Yeah, and I bet sleep is pretty lacking once you're on your survivorship journey. So I think that's an
yes.
important part of it all too.
Absolutely. For whatever reason, if
Mhm.
you're anxious, if you're fearful, or if you have sleep apnea, there's
Right.
so many different reasons that you could have these issues. And so we work through all of that with them.
It's amazing. Oh.
Yeah,
Well, I hope that you can help as many women as possible with your
absolutely.
program. And if there was something that you could say to the survivors, the thrivers, and the previvors, you have the floor. The floor is yours.
Yes. I would say that you're not alone in
Mhm.
this journey and there's help out there.
Mhm.
You just have to find the people that are willing to listen and to help you. And there is really good care available for you. So that's what I would say.
Thank you. Thank you so much. And thank you
Absolutely.
all for watching. Join us next week, and we will see you soon on the FEM Health Podcast.